Jacqueline DuPont, a gerontologist, here to talk today at Vista Gardens. However, I do make it over to Irvine Cottages as well. But today I'm focused on ageism in the healthcare setting. And the reason is, I think as gerontologists, we all work in this setting and we've tried so much. I mean, our plight has been to respect and honor older adults. However, when we're working in this field and we're going to the ER and we're helping families and helping caregivers and employees, it seems like we overlook this big elephant in the room. And the big elephant is ageism. And it's rampant in the healthcare setting. And when we look at the positives of longevity and how wonderful it is, despite these positive outcomes of living longer and healthier, we still have our younger population and even others mistreating the elderly. And when I say mistreating, mainly in a microaggressive way, not so much blunt discrimination as Dr. Butler described in 1975 when he coined the term ageism. I would say it's more of a subtle underlying ageist attitude that has really harmed older adults. And you just see it. My own dad, who just had a botched surgery on his eye, it was just cataracts, but unfortunately the physician really had a hard time with him. And he's a difficult patient with his Parkinson's. However, timing was off on the medications and he didn't pay attention to it. But we don't blame the physician. Things go wrong in healthcare. But when I went in the next day, took my father in with my husband and my stepmother, we're sitting there talking to the physician. He would not look at my dad. He literally treated him like he was dead. He didn't exist. He wasn't in the room. And I went to him and said, he's right here. He's fully cognitively fine. However, even if he wasn't, we don't need to look over, look around, or not look at all at our residents, at our patients, at our clients. It's not ethical, it's not moral, and it's not right. So when we address diversity and inclusion and equity, we are often looking at marginalized groups. And I'm not saying older adults in our country are marginalized. I'm just saying they're discriminated against. And we really need to address this and focus on it in such a way. So I've come up with an idea just on a micro level to solve this problem at Vista Gardens and Irvine Cottages. We're going to have a poster contest on Fight Ageism with a $1,500 prize for first place. And I'm trying to get the employees and even the managers and directors really excited about coming up with a positive way to portray aging and fight ageism. And in that portrayal, of course, we want to really define what is ageism, how do you see it, have you ever seen it with your mom, your dad, your grandma, your grandpa? Because the extended family is gone, we want our younger population to really understand this problem, a practice. So I'm really, really hoping that this poster will be positive. I'll let you know how it goes. I'll be sure to show you some of the great graphics or portrayals of ageism and how we can fight it and how we can really, really just nip it in the bud and hold people accountable, especially in the healthcare setting, because we're dealing with older adults quite a bit. As a matter of fact, there was one study showing that older adults went to the doctors or a healthcare professional once a month. So that's 12 visits a year, whether it's a therapist, physical therapy, whatever it is, they're having more visits to healthcare. And that just means as healthcare professionals, we really need to be aware of the way we look at, speak to, and address our older adult clients. So thank you for tuning in. And if you have any comments or any ideas regarding this poster, I really want to hear from you. Thank you.